8:13 now, 8 days till Christmas, Thursday, December 17th. It feels like it outside today, highs of 51. Chilly now, we're averaging around the maybe 40-degree mark if you look throughout the area. And quickly scanning ahead to the rest of the week and up to Christmas, 70 for a high on Christmas Eve, 30% chance for showers, 60% that night. But then Christmas Day, highs of 51 and sunshine. So everybody will be able to get out and play with their new stuff. Dr. B joins us now, our friend Dr. Brent Wallis, Chief Medical Officer of People's Health. Stroke, fifth leading cause of death in the United States. And we're going to talk about that today. Good morning, Doc. How are you?
Hey, Tommy. I'm doing great. How about you?
I love this cold weather, so I'm doing okay. On average, somebody suffers a stroke every 40 seconds. And that's about 795,000 Americans suffer strokes each year. And about every 4 minutes, somebody dies of a stroke. So, Doctor, what should we know as it relates to stroke, not just for elderly parents, but for us?
Yeah, stroke is a major problem in the United States, and really people need to understand what a stroke is. It's really the brain requires blood in order to function, just like all of our organs. And so anytime that blood is interrupted or stopped along the blood vessels supplying it, then it loses energy and it becomes injured. And if that blood is obstructed for more than a couple of minutes, then that injury can even become permanent and result in tissue death, of the brain tissue. And depending on what that region is, that's what causes the symptoms of a stroke.
And what are the effects of a stroke?
So it depends on a couple of different things. Mainly it's the location of where that obstruction or the blockage occurred, and then also the extent of the brain tissue that's actually affected. And it's kind of interesting. The brain is structured so that one side of the brain actually controls the opposite side of the body. And so when you're looking for symptoms of a stroke, what can happen is a stroke on the right side of the brain will actually cause weakness or even paralysis on the left side of the body, and often actually on the right side of the face because the nerves cross in the head. And then some other problems can be vision problems, which can be blurry vision or even blackout vision, which is definitely a bad sign. And then it can actually affect your behavior as well. So people with strokes on the right side of the brain can actually become a little more quick and inquisitive and a little more active, but they also can have memory loss. And then if the stroke occurs on the left side of the brain, it's the opposite effect. So the paralysis and the weakness happens on the right side of the body. Those individuals often will have speech or language problems, so it can be stuttering or difficulty actually forming words. Their behavior actually usually is a lot slower, a little bit dampened, but they too can have memory loss as well.
I've not known that about the behavioral style, so it would almost be like maybe manic if it's on the left side or depressive on the right side, or is that not necessarily accurate?
It's not always consistent, but it actually either change in behavior is definitely a sign that needs to be investigated. So if someone has a sudden behavioral change, it could be due to something like a stroke. So that's why it needs to be checked out right away.
Wow. Are there different kinds of strokes?
Yeah, there's really two main types of strokes, and the first type we call ischemic, and that's really due to a clog in the blood vessels that supply that blood. The other type is called hemorrhagic, and that's when one of the vessels actually ruptures and can cause some leaking of blood into the brain. The ischemic strokes are a lot more common. About 83% of all stroke cases are ischemic. And like I said, that's due to an obstruction in the blood vessel, which can be caused by blood clots or sometimes severe narrowing caused by cholesterol plaques. So we call that a thrombus, a cerebral thrombus, or a cerebral embolism. The hemorrhagic strokes, which are much less common and sometimes a lot more severe, so thank goodness for that, is about 17% of cases. And that's because of those weakened blood vessels, sometimes combined with extremely high blood pressure, can cause one of the vessels to actually pop. And when that blood leaks out, it causes pressure on the brain, and that pressure can cause damage to the brain tissue.
Who's at risk for a stroke?
There's a lot of different risk factors, and we really kind of classify them into two areas. What can we affect and what can we not affect? So the things that we really can't do much about is your age. So stroke increases risk with age. What sex you are, so being male is a higher risk. Race comes into play as well, so African Americans have a higher risk of stroke. And then any prior history of stroke or a family history of stroke means that you may have another. The risk factors we can treat, though, and really we do this through diet and exercise and sometimes medication, would be hypertension or high blood pressure. Heart disease can definitely be treated. Cigarette smoking, we can't say this enough. Cigarette smoking increases the risk of stroke dramatically, and you can stop smoking. Having your diabetes properly treated is critical. And then treating high blood cholesterol or high lipids is another thing that can really modify your risk as well. And then there's a couple of risk factors as well that are not well documented. They're not completely understood, but one of them really affects us tremendously, and that's where you live. So geographic location, the southeast U.S. is known as the stroke belt. So we have a much higher incidence of stroke here than other places in the United States. And then socioeconomic factors like, education and wealth can come into play. And then excessive alcohol intake, we know causes an increase in stroke, but it's not completely understood. And certainly use of drugs of abuse, in particular cocaine and amphetamines that can really dramatically raise your blood pressure can lead to an increased risk as well.
Well, let's take a break. When we come back, we'll talk about warning signs and prevention. Very important information, especially as you gather with family members, even electronically or virtually, because you can notice some of these things going on. We'll talk about warning signs, symptoms of a stroke, and how do you prevent them when we come back. Dr. B, our guest, Dr. Brent Wallis, Chief Medical Officer of People's Health, and you'll be able to catch all of this. You can hear it all again on the newsroom page of the People's Health website. That's peopleshealth.com. All right, 8:20, time for traffic now, WWL. 8:25, Tommy Tucker, WWL, talking to Dr. B, our friend, Dr. Brent Wallis, Chief Medical Officer of People's Health, about senior health. And we really do love this segment because we feel as though we're doing some good for the community, quite honestly, and giving some valuable information. We're talking about strokes today. And again, if you missed the beginning of it where we talked about the different types of strokes and what are the effects and who's at risk, you can go to peopleshealth.com and hear it all again on the newsroom page if you click that tab. So, Dr. B, let's talk about warning signs or symptoms of a stroke as maybe we talk to people virtually, your relatives over the phone or through the computer or personally, et cetera. What are we looking for?
Sure. So the unfortunate thing with stroke is that the symptoms are very quick and sudden onset. And so what you have to watch for is sudden weakness or numbness, even tingling on the one side of the face or an arm or a leg. When it's one-sided, then stroke has to be kind of kept in mind because that could be what's going on. Like we talked a little bit about before, sudden confusion, trouble speaking, or even trouble understanding what people are saying to you can be another sign to watch for. And then vision problems are not uncommon. So sudden vision changes, either blurriness or complete loss of vision in one or both eyes is a troublesome symptom. And then a couple of other things that are a little more subtle: trouble walking, which can be because of the weakness in a leg, or even dizziness or loss of balance can be a sign that needs to be addressed right away. And then one in particular is a sudden onset headache, and sometimes people describe that as the worst headache of their life with really no known cause and no history of chronic headaches. So if any of those things happen, to you or to someone that you're caring for, it could be a stroke. And The one thing that's really critical to keep in mind, we're very in tune to cardiac disease, and we know what a heart attack is, and we know if you think you're having one that you have to go to the emergency room and call 911. Well, a stroke is really, it's a brain attack. It's very similar. It's a medical emergency, and so you should call 911, and have that evaluated immediately. The one good thing, if there is something good about strokes, is often they can be preceded by something called a transient ischemic attack. And we shorten that to TIAs. People are more familiar with that term. But what that is it's a warning sign of a possible coming stroke. It's usually when there's a little obstruction to that blood flow, but it's either brief or it's a small amount of obstruction. So it can cause some of these symptoms, but they're transient, just like the name says. So they'll go away sometimes after a few minutes, sometimes after a few hours. The problem is you don't want to ignore a TIA because it's really a warning sign and an indicator to you that something's going on and you need to get it treated right away.
How do you prevent a stroke? Can you?
Yeah, you definitely can. Those modifiable risk factors are where this is very important. So living a healthy lifestyle, making really good choices with diet and exercise, we can't say that enough. Blood pressure needs to be controlled. So if you have high blood pressure, making sure you consistently take your medication. Cholesterol definitely is a risk factor, so making sure you take your lipid-lowering medications, and then treating your heart disease. And then really critical is cigarette smoking. Cigarette smoking is a strong risk factor for all types of vascular disease, and stroke the same. And so that should be stopped immediately. And then just to reiterate what I said before, those TIAs are really a strong warning sign. So if you are having anything like that you think may be a TIA, it's critical to talk to your doctor about that so they can investigate and see if there's anything else that you may need to be on or anything else you may need to do.
Doc, I can't thank you enough for all the information you give us, you and People's Health, and I hope you and your family have all the blessings and peace and joy that this holiday season can bring you.
Thanks, Tommy. You too. Have a great Christmas.
You too, sir. Thank you. You can go to peopleshealth.com and you can hear the entire thing if you missed any of this about stroke or any of the topics we've discussed. If you click on the newsroom page of peopleshealth.com, you can call 866-687-7335. You can always follow People's Health on Facebook, Twitter, and Instagram. 8:30, time for WWL First News. For that, we go to Dave Cohen.